Blinking. Blinking is not something that we think about very often, but we should think about it because it's incredibly important to the health of your eyes. So blinking serves a purpose. The purpose of blinking is to protect the surface of our eye and to spread tear film across the surface of the eye. Every time we blink, what should happen in an ideal world is that your upper lid meets your lower lid and gives a little squeeze. And when this happens, some oil should get released onto the surface of your eye. When this oil is released, it coats the surface of the eye and essentially it keeps our tear film from evaporating too quickly. The majority of the time that we see patients with what we call dry eye disease, it's not truly dry eye disease, but it's more accurately termed meibomian gland dysfunction. These oil glands often become clogged if we're not blinking correctly. And when I first started in practice, which was many, many years ago, many of my patients that had dry eye were older, particularly older women. And as I continued to practice, I started to see younger and younger patients with dry eye disease. And we now know why that is. It's because of computer use, digital device use. When we are on a digital device, we essentially blink half the amount of times that we would normally blink. And not only do we blink less, but we don't blink completely. And if you're not completely blinking, you're not squeezing any of this important oil onto the surface of your eye. So the question is, what can you do about it? And the answer is actually quite simple. There is a muscle around your eyelids. It's called the orbicularis. And just like any other muscle in your body, you can train this muscle to work better and you can make it stronger. And the easiest way to do that is by committing to doing some blinking exercises daily. Make an effort to do these when I wake up in the morning because often my eyes are a little bit dry when I wake up. And then I also do them before I go to bed at night. And it's simple. I usually just do a repetition of 10. And you can do it by just gently closing your eyes. I like to do this slowly, as when you blink slowly, it can relax you and that can actually release some tears. And then you make sure that your eyes are completely closed, that your upper lid is meeting your lower lid, and you give a gentle squeeze. I think the trick to that is not squeezing the rest of your face. So when you tell somebody to squeeze their eyes, they typically involve all their facial muscles. And we're not really trying to train all of our facial muscles because when we blink normally, we're not squeezing all of our face. And so you can think about it and you can challenge yourself to squeeze your eyes shut just using your eyelid. And I think that if you do that a few repetitions multiple times a day, you can actually really improve your blinking. And this is particularly important to my big computer digital device users, which are a lot of my patients these days.